Hello everyone, myself lecturer Miss Aditi Anil Kushare, Master of Pharmacy in Quality Assurance Techniques from KK Institute of Pharmacy, Chandori, Nasik. Today we are going to discuss about the topic emulsion, that is instabilities and preservation of emulsion from pharmaceutics too. So the topics to be covered from this session are as follows: Introduction to emulsion as a biphasic liquid dosage form, instabilities in emulsion, preservation of emulsion, and packaging, labeling and storage of emulsions. So let's discuss about the definition of emulsions. An emulsion is a thermodynamically unstable system consisting of at least two immiscible liquid phases, one of which is dispersed as a globules in the other liquid phase. That system is stabilized by the third substance called emulsifying agent. In this, dispersed globules are also called as internal phase, which is present in the minute quantity or lesser quantity as compared to other liquid phase, and other liquid phase is also called as continuous phase or external phase, which is present in the excess concentration as compared to the dispersed globules. Let's discuss about stability of emulsion. So we will get the idea about instabilities occur in emulsion. An emulsion is said to be stable if it remains as such after its preparation. That is, the dispersed globules are uniformly distributed throughout the dispersion medium during its storage. The emulsion should be chemically stable and there should not be any bacterial growth during its shelf life. Emulsion instability may either reversible or irreversible, and it manifests in the following ways. That is, first one, cracking, which is irreversible instability, means if cracking persists, we cannot get again stabilize the system. We cannot stabilize the system. Second, flocculation. Third, creaming. And fourth, phase inversion. So first one, let's discuss in detail about cracking. Cracking means the separation of two layers of dispersed phase and continuous phase due to the coalescence of the dispersed phase globules, which are difficult to redisperse by shaking. Cracking may occur due to the following reasons: by addition of emulsifying agent of opposite type, means simply if our system is of O by W type, oil in water, and we are going to add W by O type of emulsifying agent, then in that case the emulsifying agent is of opposite type, so there may be chances of cracking. Second, by decomposition or precipitation of emulsifying agent. Third, by addition of common solvent. Fourth one, by microorganism, by growth of some microorganism or bacteria, pathogens, by change in temperature, and sixth one, by creaming. These four are physical instabilities of emulsion. This is the good emulsion, which is seen in this figure at the center. This first one is coalescence. Second, that is, this is flocculation. Floccules aggregates will be formed. Third one, that is creaming. As like cream, it will collected at the upper surface. And fourth one, that is breaking. Means system get baked. So let's discuss about second type of instability, that is flocculation. In flocculated state, the secondary interaction van der Waals forces maintain the droplets at a defined distance of separation. Application of shearing stress to the formulation, that is shaking, will redisperse these droplets to form a homogeneous formulation. Although the flocculation may stabilize the formulation, there is also possibility that the close location of droplets would enable droplet coalescence to occur if the mechanical properties of the interfacial film are compromised. Then third instability, that is creaming. Creaming may be defined as the upward movement of the dispersed globules, means internal phase, to form a thick layer at the surface of emulsion. Creaming is temporary phase because it can be redistributed by mild shaking or stirring to get again a homogeneous emulsion. The factors affecting the creaming are described by Stokes' law, that is V is equal to 2R square into D1 minus D2 into G upon 9 eta, where V is equal to rate of creaming, R is the radius of globules, D1 that globules of dispersed phase, internal phase. D1 is the density of dispersed phase, or we can say it as an internal phase, and D2 is the density of dispersion medium, that is of the continuous phase or external phase. G is equal to gravitational constant, and eta is the viscosity of dispersion medium, which is continuous phase or external phase. The following approaches can be used for decreasing the creaming. Radius of globules means, if, as we seen in the last slide, that is V is equal to 2R square into D1 minus D2 into G upon 9 eta. In this case, V is directly proportional to radius. As radius increases, then rate of creaming will increase. D1 minus D2, this is the difference between the density of dispersed phase and dispersion medium. So if the difference is less, then again the rate of creaming will be decreased, or it should be less. G is the gravitational constant, and in case of eta, as eta is in denominator, it should be inversely proportional. Means as we have to decrease the rate of creaming, so eta should be higher. Means if the viscosity of dispersion medium is high, then the rate of creaming should be low. That means V, rate of creaming, is inversely proportional to eta, that is viscosity of the dispersion medium. So the approaches which should be done to decrease the creaming, that is radius of globules. If we should decrease the radius of globules, then there must be rate of creaming should be decreased. Difference in the density of the dispersed phase and continuous phase. If that D1 minus D2 difference, that value should be less, then the rate of creaming will be decreased. Viscosity of dispersion medium. If the viscosity of dispersion medium is increased, means the value of eta is highest or higher, then only the rate of creaming should be lesser or less. So in this case, we have to increase the viscosity of dispersion medium. And storage conditions. If we maintain the properly given storage conditions, then our system should remain stable. So there the chances of creaming are lesser. Then fourth one, phase inversion. Phase inversion means the change of one type of emulsion into other type, that is oil in water emulsion. In this case, oil is the internal phase and water acts as external phase, will changes into the water in oil type, and vice versa. Means O by W type of emulsion will get changed to W by O, that is oil in water to water in oil, and vice versa, means water in oil to oil in water, W by O to O by W. Due to the following reason, the phase inversion takes place by the addition of an electrolyte, by changing the phase volume ratio, by temperature change, by changing the emulsifying agent. The phase inversion can be minimized by keeping the concentration of dispersed phase between 30 to 60 degrees Celsius and storing the emulsion in a cool place, and using a proper emulsifying agent in adequate, that is in a proper concentration. Then last one, that is coalescence. Coalescence is a growth process during which the emulsified particles join to form large particle. Particularly it occurs in oil in water system containing non-ionic surfactants and in water in oil system in which electrical effect are negligible. So that reason variety of natural gums and proteins used at low levels, and it can be used at higher concentration as primary emulsion. Preservation of emulsions, that is microbial contamination may occur due to the contamination during development or production of emulsion or during its use. Then usage of impure raw materials, then poor sanitation conditions, then invasion by an opportunistic microorganisms, then contamination by the consumer during use of the product, then precautions to prevent the microbial growth are use of uncontaminated raw material and careful cleaning of equipment with the steam. Then packaging, labeling and storage of emulsions. In this, it depending on the use, emulsions should be packed in suitable containers. Emulsions meant for oral use are usually packed in well-filled bottles having an airtight closure. The light sensitive products are packed in amber-colored bottles. Then for viscous emulsions, the wide mouth bottle should be used. The label on the emulsion should mention that these products have to be shaken thoroughly before use. External use products should clearly mention on their label that they are meant for external use only, and emulsions should be stored in a cool place, but refrigeration should be avoided as this low temperature can adversely affect the stability of preparation. So what we learned from this topic, emulsion, instabilities and preservation of emulsion, the learning outcomes are: what is emulsion as a biphasic liquid dosage form? Then instabilities in emulsion, preservation of emulsion, and packaging, labeling and storage of emulsion. Thank you.